Hey everybody, I want to tell you why your sciatica diagnosis is wrong. Pay attention to this video if you have been diagnosed with sciatica or if you have that. So my name is Dr. Aaron Andrews. I'm a chiropractic neurologist at PC Medical Centers here in Cape Girardeau, Missouri. Our office is the only integrated clinic in the area. Actually, the only integrated clinic between Nashville, Memphis, St. Louis. So we have multiple doctors working together from multiple disciplines to get you the best benefit, get you off your steroids, get you off your meds, avoid surgery. So pay attention to this if you have some disc problems, okay? So my little teaser, why you do not have sciatica. So we have a lot of patients that come in our office in one of the first questions, what's going on? Oh, I've been diagnosed with sciatica. My medical doctor diagnosed me with sciatica or whatever. Okay, that's great. Sciatica is a symptom. It's not a diagnosis. So my question to them is, well, let's find out what's causing your sciatica. So if you've been told you have sciatica, well, we need to find out what's causing it, okay? Sciatica, if you don't know, is the pain, sometimes numbness, tingling, but the pain, burning that may go down, into your butt, down your legs, down in your calf, and even your foot. So sciatica is a symptom, like I said, not a diagnosis. So what's causing it? Most of the time, it's a disc problem, all right? And this video is our symptom of the week, disc problems, disc bulges, disc herniations. I wanna go over and explain the different kinds, all right? But first, let's talk about some anatomy. So here's a spinal segment. You've got your disc, you've got your vertebra, disc, vertebra, got your nerves come out right in between these. They have just enough wiggle room. And then here's the back, your spinous processes. That's the bumps you see. So your discs are in between your vertebra, all right? And they're like little pillows, little shock absorbers. They take a lot of the brunt of the stuff you do throughout the day, all the repetitive stress, the heavy lifting, the sitting. And they are shaped like little jelly donuts, they call them, all right? There's this hard rubber band around the outside, and then there's a bunch of layers of cartilage. You guys see all those layers? And there's this jelly stuff in the middle. Fun fact, that jelly looks like crab meat. It's kind of weird whenever you see it in a surgery. So over time, this disc can get thin. It can dry out from not enough water. Like I said, repetitive stress, sitting, aging. And when it dries out, this jelly here can seep through these cracks, just like water does in your basement. It's gonna find a way. Same thing with this jelly. It's gonna seep through these cracks and it's gonna get to this hard outside rubber band, and then it does a couple things. So first thing, your disc can just bulge or protrude, okay? And here's another spine. So you see this one has just kind of flattened out and bulged all the way around, kind of like a hamburger that's too big for the bun, okay? Oftentimes it can bulge to one side or the other and get close to this nerve that can give people sciatica or pain down the arm. So these disc problems can be in the neck, not just in the low back. Very important. So that's the first one, like I said, is a protrusion or a bulge. The second one is a herniation or a ruptured, or sometimes people call it a slip disc. So then you actually have a tear in this outside, and this jelly will kind of get to that outside, and it will even bulge even further or herniate out, kind of like biting on a jelly donut and the jelly goes outside. And then it really can get close to these nerves, pinch them, irritate. You can get some compression and even more symptoms like numbness and tingling, weakness, a lot of pain, burning. So there's a lot of different symptoms for these disc problems. And that again is easily treatable. The next kind is called a sequestered disc or a fragment. And that's when this jelly totally spurts out of here, and you usually have to go and get that cut out. Your body can absorb that, over time, but it's usually a lot of pain, and you don't want these nerves compressed for a long time, and you need to go get that cut out. That's the least rare, or the rarest, I guess, of all the disc problems. We don't see that very, very often. Usually you get the bulging disc like I talked about, or the herniated disc. Both of them very treatable. So those are the different kind of disc problems, okay? If you guys are suffering from pain down your arms and legs, or back pain, sciatica like I talked about, which is not a diagnosis, you have numbness and tingling, pain down your arms, come in. We have free consults for that. We can find out if you are suffering from a disc problem, find out what stage you're in of these that I just talked about, and get you some help. Like I talked about, we're the only multidisciplinary clinic in the area, which means we have different doctors and different disciplines that are treating everything to improve your function without surgery, without steroids, and without opioids, which are very dangerous. So give us a call for a free consult, and I really appreciate you guys. Hope you all learned something about discs, and now know that sciatica is not your diagnosis. That's only a symptom. You guys have a great rest of your day.